My name is Alexandre Marra. I'm professor of the Pós-graduação Stricto Sensu program in Health Sciences at Albert Einstein Instituto Israelita de Ensino e Pesquisa, and also I'm a researcher at the Hospital Israelita Albert Einstein. I am doing research at the University of Iowa, Internal Medicine Department in Iowa City, Iowa, for 6 years and a half. I'm really excited to introduce the 8th presentation in the Einstein Connection series of guest speakers. Einstein Connection is our international program that intends to connect Brazilian researchers, students, and healthcare personnel with international professors and international researchers. It's my pleasure to introduce our guest speaker, Dr. Abdullah Algwizani. He's the Chief Executive Officer at the Public Health Authority of Saudi Arabia, Saudi Arabia's National Center for Disease Prevention and Control, CDC. Dr. Algwizani performed infection prevention and control fellowship at the University of Iowa hospitals and clinics. I have been honored to have Dr. Algwizani as a friend at the University of Iowa, and it's been rewarding to see Abdullah collaborates with so many international projects. He'll talk to us about Saudi Public Health Authority from its inception as the founding chief executive vision to control coronavirus. We have planned for Dr. Algwizani to speak for 30 to 40 minutes, after which we'll have 10 to 15 minutes to answer questions. You can unmute yourself and ask your questions after Dr. Algwizani's talk, or you can type your question in the chat. I'd like to ask all of you to answer the survey at the end of the presentation. Thank you, and we now hand it over to Dr. Abdullah Algwizani to start. Abdullah, the floor is yours. Thank you very much.
Thank you, Alex. I'm very happy and pleased to be with you here in this wonderful gathering. My name is Abdullah Algwizani. I am infectious disease specialist, infection control specialist. I'm internist in background. I was given the honor to establish the Saudi Center for Disease Prevention back then in 2018, and then transformed to be the Public Health Authority after separated from the Ministry of Health. And I'm sorry for I'm not presenting from my office, as it's 6 p.m. in Saudi Arabia. It's already after working hour, and I'm sure that the time difference is suiting all of us. So forgive me if not presenting from my office. And I'm delighted, I'm happy that to be here and to present this talk about, it's a friendly talk about what's the Public Health Authority from its inception, and how we went through all the COVID as a new entity, how we go through all these extraordinary experience that not very often that an established public health authority face unusual or at its startup. So Public Health Authority, the name is Wikaya in Public Health, or BHA, standing for. It used to be the Saudi CDC, but after transformation, it started to Public Health Authority. So Public Health Authority, also known as, or formerly known as the Saudi Center for Disease Prevention and Control, was established under this organizational structure of Ministry of Health in 2013, but it wasn't activated. It was a resolution, but has not yet been activated. The activation empowerment of Wikaya was announced in Kingdom Saudi Arabia Vision 2030 in 2016, and been fully activated by 2018. It was required to the function was to reduction and monitor communicable and non-communicable disease and promote health research, study, and prevention of control of communicable and non-communicable disease. The resolution number 200 also detail a consolidation of public health function currently distributed across the entities, including activity related to health research on the prevention and control of communicable and non-communicable disease from a public health department in MOH. So we started in 2018 formulating the team of the Saudi Center of Disease Prevention and Control. And as we say that we were building the plane while we are in the air, actually. We have to activate that center at that then, and we need to fulfill its mandate, and we need to be very ready for any, and we started the work with the recruiting the team, try to establish the lab that needed for the team to work and ready. And it's a coincidence. We were in October 2019, which is almost November 2019. We finalized the influenza pandemic response. So we were mimicking in November that we will have what we'll do if we have influenza pandemic outbreak. And then after 2 months of that, in January or December, actually, we start to have of the pandemic of COVID. So we went through all the pandemic, which all difficult times back then, and we were up to the challenge. In March 2001, the Council of Ministers issued Resolution 401 announcing Wuqaya as a financially and administratively independent entity that reports to the Board of Directors chaired by His Excellency Minister of Health. It's aimed to protect and promote public health, prevent disease, and increase preparedness and response for public health emergencies by organizing effort between the relevant entity and the Kingdom of Saudi Arabia. And the vision is healthier and safer life for all and lives and communities. Mission to protect and improve the health, safety, and health security of the people of the Kingdom of Saudi Arabia. Value reliable, data-driven, collaborative, and excellence and innovative. And the mandate of this public health authority or Wuqaya is under 5 theme, which is health improvement and disease prevention, public health intelligence, health security, public health workforce planning, and public health laboratories. And under health improvement and disease prevention, our job is to develop and monitor and evaluate and oversees implementation of public health policy, program, and plan and initiatives, to review regulation and policy related to public health and raise to relevant concern, hold the conferences and workshops and share materials related to public health. In the public health intelligence, we conduct surveillance and monitor the public health risk factor and threats on the local and regional and national level, house a database for a disease and epidemic and public health risk, document and share the public health evidence and information and purpose of scientific solution to a public health issue and its risk. In the health security, we develop preparedness and response plan for public health emergencies, approve and evaluate the safety and preventive healthcare measure for the public health risk, represent the Kingdom of Saudi Arabia in public health and regionally and internationally. In the public health workforce planning, our mandate is to work with the related stakeholders to prepare the future workforce need by preparing and circulating the standard for public health professional with the basic requirement needed for the public health curriculum, accredit evaluator and accredit a practitioner for public health work, coordinate with the government entities to audit the public health practitioner and collect information to produce recommendation and action, In the public health laboratory, our mandate is to approve policy, procedure, standard, and requirement for public health laboratories, coordinate with the relevant accreditation body to tie the laboratory licenses to accreditation, to establish the high containment laboratory, and form a cohesive network for information sharing between laboratories in the Kingdom of Saudi Arabia, and determine the priority for transfer and development of technology related to development of medicine, vaccine, and antibody. And the Public Health Authority scope of services and communicable disease, health and promotion, healthy environment and communities, public health lab, and public health academy. All these are the scope that you are working with. Public health protection and emergency and preparedness, public health intelligence and surveillance, and global health. And the board of directors of Public Health Authority constitute of multi-sectoral, and they represent from the ministry of all the ministries, all the key people that, or key entities that need to be a partner of the any public health, a wider scope of the public health system. So when coronavirus in Saudi Arabia, we know we experience two types of coronaviruses. The first one was in 2012, when we had the MERS, which is the Middle East respiratory syndrome, COVID, was observed in 2012. And we established a committee that chaired by His Excellency Minister, and we did a tremendous work to contain it. And it started to be endemic in Saudi Arabia with relation to the camel. Public Health Authority wasn't established back then, but it was very important to show that we need entities like CDC, which later on become a Public Health Authority. In 2019, we only start to have the first case of, or actually before the first case of COVID, establishing of a COVID committee chaired by His Excellency the Minister of Health and composed of 24 participating entity as to facilitate and to execute the response that need with extra fund and response from the to control the virus. If you see the committee that concern of tackling COVID, it's actually more than 24 entity. One of them is WICAIA or BHA, and we have org structure that orchestrate the response for the COVID. So what we did actually is to activate all the national and regional command and control center. We suspend travel through the through this area at that times, both social distancing and thermal screening of every public place, mandate wearing masks for all, increase the local manufacturing of PPE and other infection control supply, mass field. We issue a free testing and treatment for all, strengthening the capability and resources and expanding the laboratory capacity. We suspend Umrah and education, international and domestic flight for certain time for pandemic. Partial and total curfew, as you remember, all the world was having, and Saudi Arabia were part of the same response. Treat all citizens, even the illegal residents, free without any consequencing, and this is a very application of the healthcare for all people. Any people in Saudi Arabia, even if he presented illegal, he will be treated free of charge without any consequencing. Developing the 937 from MOH to support people by answering 24/7. We had help and contribute in central platform for tracking any suspected case and their laboratory result, BHA, Public Authority, and MH assigned committee and expert task force to develop protocols and guidelines based on the best practice, clinical trial, and previous experience on MERS, COVID. And we had a national plan to manage PPE supply stock, and we would work together and collaboratively with the other entity. So KSA has developed several digital platform and media app. We did have the Tawakkalna. Tawakkalna is started to issue a permit for traveling during the curfew. And then it has progressed, expand to show a status of immunity of COVID vaccine, COVID test result, issue health passport, and other function. And people required to show Tawakkalna status to be able to prove their immunity and to access public places. And in Saudi Arabia, we had Tatamman used for those confirmed or suspected COVID cases, also used to, for contact with those who have confirmed with cases and waiting for their result. It's actually more of a application and also to provide the test result and advice for quarantine and isolation. We have also Taba'id using conjunction with Tatamman, designed to notify and support who are in contact with infected people. And we in Waqaya, we help to design the blueprint, which was being taken by the MOH for a Ta'akkad clinic, which is the mass testing for COVID, which is based on testing clinic available through the kingdom, both mobile and stationary. And we have also Tatamman walk-in clinic, which is basically it's a fever clinic, which has been adapted by Ministry of Health for any people who have fever can come and check for them free of charge. And for the COVID vaccines, in 10th of December the kingdom authorized through its Saudi FDA the use of Pfizer BioNTech vaccine for emergency authorization, following extensive review and of the available study and safety and efficacy. Saudi Arabia announced that the vaccine will be available for all citizens and residents of Saudi Arabia free of charge in order to achieve the highest level of immunity in the community. As of today, the third dose was available for everyone, and fourth dose is given for high-risk group. Registration process was organized and made easy through mobile application, which is adopted by Ministry of Health. And we see all the political and from all the kingdom, the king and his Royal Highness and all the ministers and all the people, they are adopting and taking the vaccine and encouraging the use and take vaccine for the whole community. Saudi Arabia known for having the holy places and Hajj and Umrah, which is we receive millions of people from more than 200 countries. So from 2.5 million each year to less than 1,000 in 2020 and to 60,000 in 2021 as a response of COVID. For this year is we will be having more than 1 million for Hajj. They all mandated by Wiqaya protocol to be fully vaccinated for COVID, and age should be less than 65 with negative PCR more than 72 hours. For Umrah, which is happening all the year, we have a comprehensive plan was developed through the coordination between the involved sectors. People must be registered in Tamarna and other application for applying for this holy pilgrims. The requirement of Umrah was set based on the age, medical condition, vaccination status, first time, and other. And now with the control, and major, we alleviated the condition. The requirement has been alleviated to be more people such are allowing children above 7 years to go inside the Holy Mosque. So these just a nutshell how Saudi Arabia and where the Public Health Authority played one. We in Wiqaya also we work through to establish a risk assessment tool at the early start of the pandemic to really risk stratify the country activity of COVID. The aim is to provide an information the risk of importation and risk of transmission into the kingdom. You know, we all witness lots of variation through this 3 years of pandemic, lots of mutation and variant of viruses that need to be tracked and controlled. The public health and to the public health authority. So this risk assessment has worked to stratify the global risk of COVID into the kingdom. Which public health authority risk tool was categorized into 5: minimal, low, moderate, and high and very high, and over risk was determined. Predefined criteria that enable risk assessment for each level and trigger action that to it include epidemiological spread of the virus in the country, the healthcare system capacity of each country, and early detection and reporting of novel virus. And we have a 24/7 team working around the clock, evaluating all these globally. Rapid response to and mitigation for this is one of the major important of that. And we have more than 100 risk assessment reports has been issued by Wiqaya. We have a daily report to be shared with the high authority for planning and preparedness and recommendation. Communication and participation in daily press conference. Public Health Authority has recognized the importance of the communication with the public through various media channel, post information, and its social media account and web page. And we participate in a daily or semi-daily conference with the either with indirectly by information or directly by our presence. We issued more than 250 protocol and guidelines for all the sector, whether it's manufacturing, educational, military, economy, all these sector, how they will be managing and to alleviate and to be agile for this COVID. We issue protocol and guidelines in targeting various segments from public health and clinical practitioner to public health and different for different places such as school, mosques, workplace, public health transportation. We're assessing the implementation of published communicable disease guideline and protocol in various community setting, for example, in collaboration for Ministry of Environment and Water and Agriculture. We found that some of the unregulated our less regulated market outside it was a high activity of virus, so we recommended to be outside the city. Public Health Authority has served as a national reference lab for the kingdom for COVID and others. We accredited more than 180 laboratory in the public health and private sector, achieving 100% of evaluation for quality check for ECAP for COVID PCR testing. We launched just 2 weeks after first case the sequencing for COVID in March 2020, which helped tracking and monitoring and local and various cases on the kingdom. The National Genomic Surveillance Program in Saudi Arabia is a national genomic surveillance program, played essential role for studying SARS-CoV from the beginning. It's working to vaccine-related and public health intervention. The epidemiological map has been developed for the strain from Saudi Arabia and continuous update. Monitor various virus evolution and early detection for any new variant raising in the kingdom. monitor all travel-related cases to understand the transmission better and evaluation of virus. Our targeted was the severe case, travel-related, post-infection, and reinfection, and viral polydynamic. We in Public Health Authority, the WHO Collaborating Center for Middle East Respiratory Syndrome, and we got the in March 2001 that WHO is recognizing the Wiqaya or Public Health Authority as a collaborating center for MERS. And the main objective of this collaboration is to participate in development of evidence-based guideline, support the WHO in development and strengthening of surveillance and preparedness system, and to act as a reference center to build capability to respond and control MERS outbreaks, to support WHO in generation and disseminating of evidence-based MERS related to MERS, to support WHO work in developing and strengthening strategy for MERS preparedness and surveillance system, and upon the request of WHO, act as a reference center for capacity building and response and control for MERS cluster and outbreaks. Where are we now? We are in 70% fully immunized, and we had a very with very steady cases so far for the COVID. So what has worked? The whole governance approach was and strength. Early lockdown of the border has worked initially. Strong social contract based on the trusts between the all sector. Maintaining essential services while protecting worker. Constant messaging, mask and hand washing and distancing. Shielding the vulnerable group, vaccination, and the importance of science-led and evidence-based decision-making, and minimize the economic impact by remote working where possible. Thank you.
Wonderful, Abdullah. Perfect. Thank you very much for your presentation. And we are open to questions to Dr. Algwizani, please. To get started, I have some questions. I have a lot of questions. Abdullah is a superstar in Saudi Arabia, and he is the CEO of the Saudi Arabia CDC. And it's my pleasure to have Abdullah as a friend. And after Abdullah came back to Saudi Arabia, we had a lot of Saudi fellows that they came to work with us in different research projects. And my first question, Abdullah, I remember that when you came here, you presented us a very important lecture about MERS-CoV and the impact that happened in Saudi Arabia. And in that time, in 2015, 2016, you know, I believe that people outside Saudi Arabia didn't give so much importance of coronavirus because MERS-CoV was limited to the Middle East countries. But I'd like to extend my question not to this MERS-CoV importance for the Middle East country, but what happened in South Korea that you talked to us, if you remember very well, and the case presentation in an infectious disease doctor that got MERS-CoV. Could you summarize these 2-3 questions?
Yeah, I think the experience that we had about MERS-CoV was something that give us a better understanding how's the MERS is getting as outbreak, and how's the coronavirus could put you in any coronavirus in the hospital, and you'll be maybe critical. And I have a very dear friend. He got a MERS-CoV, and he really got into the ICU and its complication, and it was as if MERS was only snapshot about what's happened in the COVID-19. And when we start to recognize we hear about the coronavirus and early start in China, we really recognize how serious it is, and we work very hard that we know how and if you saw it, that we see the response of Saudi Arabia and South Korea at that, it was a very good and prompt response, because we did had a taste of what could coronavirus do for you. But of course, the difference between the MERS and COVID on transferability and sustainability is totally different. But it's experience that we building ourselves, and it's no matter how much you put in effort, people start with time, they forget this experience, and much reminding of how can we work and boost our capacity and capability for sure will help us to learn. And what help actually is building on these successes and keep the momentum with people, and try to keep people alert about their capacity and capability. And of course, this is not something that you do it for once and leave it. You need to continue, keep remind yourself and ask all people, and educate ourselves in how can we as all of us, not only entity, not as entity alone. And what we learn actually that from MERS, it's not the health sector responsibility, is responsibility of all. And if we want to apply the One Health aspect, which means that the contribution of the animal sector, of the environment, all these are playing role. No matter what, if you do as a health, you need the collaboration of all people. Yes, I hope that I answered the question, Alex.
Thank you very much. And we have a question for Dr. Elisa Kozaza. Please, Elisa.
Hi, nice to meet you, Abdullah. And I would like to know how Saudi Arabia is preparing for the long-term consequence of COVID, such as cognitive demands and mental health issues. And that's it, my question.
This very good question, Lisa. Thank you for that question. We did the study and Wikaya with the other stakeholder in Saudi Arabia, and we recognized that depression, for example, as a COVID was something that we considered with a great response, sometimes reached to 40% or 50%. The Ministry of Health has issued a couple of clinics for post-COVID. What we call long COVID. We had a couple of clinics. We have clinics distributed for all the region in the Ministry of Health. The target actually is to follow people with post-COVID for any concern or any, just track them, and we to follow any side effect of or the complication of the long COVID issue. But again, we're still in the pandemic, doing it together with the longer neurological issues. But I don't know what's going on.
Yes, no problem. Considering the long COVID, we are talking about the clinic, and in the end you said that we are not only interested in COVID, in long COVID, but, and I didn't hear you.
Yes. I mean that we're not only for the healthcare worker, for all the population.
Okay.
But again, the clinic, maybe the people start to not attending that clinic as much before, because people start to live with COVID as a long term, and people they are start living also with the COVID. Yeah.
Oh, great. Yes, because this room, Einstein Connection, like Elisa is professor from our post-graduation program, and maybe she's interested to study something about psychiatry disorders for long COVID. And I'm interested too to study long COVID and other issues considering the breakthrough infection in healthcare workers taking COVID-19 vaccine. And in Brazil, we have Pfizer, but we have CoronaVac, the Chinese vaccine, and AstraZeneca. And maybe if you are interested, we can collaborate in research projects for the future to make comparisons between Saudi Arabia and Brazilian healthcare workers, or Saudi and Brazilian population.
I would be more than happy to have it.
Great.
Really, we're more than happy to collaborate and see how things go between the two countries. That we're more than happy.
Wonderful. Do you want to comment anything, Elisa?
Well, I have been interested in this cognitive problems as well as depression, anxiety coming from COVID-19. So yes, we may talk about.
Yes, Salim. I think we did a study during the COVID, during the pandemic, which were the curfew and people alarming, the anxiety and depression was in the high. But the long aspect, we do have a study about MERS, for sure. There was a depression with the MERS as a long post-MERS. But we'll be more than happy to look our data and crunch it and see how we can do something jointly. Yes.
Any other question? I have another question, Abdullah. I'm really excited to see about your National Genomic Surveillance Program. And I read in Lancet, one of the Saudi papers about that was wonderful, because doing a genomic tracking and considering all these issues that these mutations is happening in this SARS-CoV-2. And Albert Einstein has a surveillance system that we are collaborating together. The coordinator of this is Dr. João Renato. He's not here, but he's collaborating in many research studies with us. And maybe that's another opportunity to merge data from Saudi Arabia and Albert Einstein. And one of my questions, considering, because there are a lot of good stories about you and about your expertise, 10 years understanding, study coronavirus because of MERS-CoV. And what is the situation? My question is, in 2020, when we had the first cases in Brazil, I think that was February or March. I think that on March, and Saudi Arabia is the same time that I wrote down here, March 2020. What is the situation when you had the first case in a place where is another coronavirus, another MERS-CoV? Did you have any co-infection, MERS-CoV, SARS-CoV-2, or not? Or the situation is under control considering the MERS-CoV?
Sure. Well, that's a wonderful question. We thought at the start that we might have a co-infection, and we monitor that. We did not have so far any co-infection, or the risk always with these viruses getting together, and we did not have such thing on the aspect. It'd be interesting to see the impact of this mass vaccination in the MERS by itself, the activity, and that's something we might observe and see how things goes. Maybe this vaccination and level of the antibodies might have protection, theoretically not, but we would love to see. Maybe we'll have some more, or even the infection, which is, you know, that the vaccine itself is based on the S protein, the infection for all the virus. But I think we, as an endemic, would be very interesting to see this post-COVID on the MERS activity, and And also, not only that, also the therapeutic that's been used for COVID, for treatment for COVID. It's very interesting to see the therapeutic for MERS. A lot of activity that for sure that would be an important. We did have work with the MERS vaccine for the camel with the K mark. So we vaccinate the camel against MERS, and it has been successful. I think the work is being taken by the K mark, because the National Guard or King Abdullah Research Center. But these all are our area of studying, and we are keeping an eye on this, and we are trying to work on this research. And we're more than happy to collaborate with you, Alex, or anybody from our colleague from Sao Paulo and at this time.
Wonderful.
Hospital.
Wonderful. Well, I have a lot of questions.
Very interesting, and we are eye on this.
There's a question in the chat.
Oh, great. Leonardo Rocha. Oi, Léo. Hi, Dr. Algwizani. Congratulations on the high quality of your presentation. I'd like to ask you if recruitment of international healthcare workforce was necessary to help with the pandemic. That's the question. Well,
we didn't really require the healthcare worker in this regard. We managed to have it within this one. It was difficulty at start, but we leveraged to work within our resources. Saudi Arabia is open for multi-nationality that work with us in different aspects. We are open for all nationality, but there was no necessary for healthcare delivery system to have this international recruit for that. Yes.
Great. Do you have any question, Elisa?
I think it's okay for me.
Great.
Yeah.
Abdullah, considering the COVID-19 reinfection, that many studies now showing that who got COVID-19 infection, received the vaccine, will be more protected, to get another infection. What is the situation if someone got MERS-CoV, took the COVID-19 vaccine, they are more protected to have like a less severe COVID-19 disease?
Well, that will be a very difficult question to answer, but I know people who get MERS and they got the vaccine and then they got the COVID for sure. But it was a safe. I don't think it's because of the MERS. It's because of the vaccine, I believe. But again, this is much good sample and with good molecular and biological testing for this one. We know for a fact that infection or vaccine, the immunity will win anyway. That's happened for the COVID, and I think MERS will be no different than COVID, that all this immunity will win in terms of humoral immunity. But in the cellular immunity, there always is some part of it to prevent and try to protect. It's very, very difficult to say that previous MERS infection was protective, but there was people in Saudi Arabia who were MERS and then they get infected and people with the COVID and they reinfected again with COVID. So I don't think it's a preventive or protective, but no one can really assure unless we did a head-to-head comparative study.
Oh, great. Yes, and for everybody that is attending this session today, I want to emphasize that Dr. Algwizani is a superstar in Saudi Arabia because he finished his fellowship and he one of the founders of the CDC in Saudi Arabia. And this is a very important situation because to fight COVID-19 pandemic in the Middle East region. And my question to you, Abdullah, is the Saudi Arabia CDC I'm really interested to know how is the relationship, because we know that there are the CDC in the US, the European CDC, Singapore, and other countries. What is the relationship between among all of these CDCs? How it works?
Well, Saudi CDC, which turned out to be public health authority, is a part of the International Association of Public Health Institute, IANFI. I sit in the executive board as a member. We work collaboratively together with these entities in order to learn from them and help other entity as well. I happen to be one of also who helped to establish the Gulf CDC, which is the it's an inter Center for Disease Prevention, and we are working collaboratively with all the sovereign right for the country, but we work collaboratively with a mutual respect and cooperation.
And I'd like very much to see about the WHO Collaboration Center that you are part since 2021, that's right?
Yes, we'd be more than happy to have a further presentation about it, deep dive on the collaborating center, and we're working also to keep this momentum with the MERS, with the WHO. Yes.
Oh, wonderful. And for everybody that is attending this session, I want to emphasize too, because I learned a lot with you during 2016 when you said about the MERS-CoV in Iowa, and after the other Saudi fellows, Mufaha, Mohammedis, they helped here because, you know, a lot of doubts. What is the best diagnostic method? And someone was guiding to the serologist. No, serology doesn't work, and that's true because that's the same virus. Of course, MERS-CoV is different from SARS-CoV-2, but the origin is the same, coronavirus. And I remember that Mohammed told me, no, please talk to Albert Einstein lab, RT-PCR. That's the gold standard, and that's the gold standard RT-PCR. That's the first part. About the infection prevention, I remember that I see your pictures in 2016 about the drive-through, and I see now, and that's the same pattern that everybody around the world is doing this as an infection prevention, like doing cohorts in hospitals, like this is COVID, this is non-COVID, because I remember that you showed us about MERS. This is MERS. This is no MERS, and that's really important because all the Saudi expertise helped not US. I remember that in Iowa a lot of meetings, and they requesting about Mohammedis, what they think and what is the experience in MERS-CoV. Probably they talked to you about that time in the beginning of 2020 here. I appreciate your help and your collaboration because you have not only Iowa, but my thoughts for people in Albert Einstein. All the credits is to you. And we are finishing our presentation today, but I have one comment here. Duncan Selby, Abdullah Algwizani is a public health rock star. Yes, you're right. And regional leader, and should be immensely proud of his work in establishing the Saudi Public Health Authority and in supporting the pandemic response in Kingdom. We all have much to learn from them. Duncan Selby, President. Yes, I totally agree with you, Duncan. I'm really proud of you, Abdullah, and thank you for everything.
Thank you, Alex, for the lovely time, and thank you for this very lovely comment. I missed my desk, which is behind you. This was my desk.
That's your room.
Yes, I miss it. And thank you. Yes, and please say hi to Pedro and all the new children and your wife and all the friends in Iowa. And thank you, and for all the folks in Sao Paulo. for our colleague of Brazil. Thank you very much. I'm very honored. I'm happy to be with you and always be for any invitation. Be more than happy to be there. Thank you.
Thank you. And Pedro is here in the room. Pedro, do you want to ask any question to Abdullah?
No, I don't have any questions, but thank you for the presentation.
Good luck, Pedro. Good luck in the med school. I hope that you have a very.
Thank you very much. Thank you very much.
Thank you, Pedro. Thank you.
Okay, Abdullah, thank you very much. I really appreciate if there is any other question. I'm really glad to see you again. I hope that you visit us in São Paulo, Brazil, when the things are better. Or if you want to be in Iowa, yes, you can be at home.
Yes,
thank you
for
very
sure.
much. Appreciate it.
See you soon. Bye bye all. Bye bye.
Bye bye.
Thank you.
Thank you.
Thank you.
Thank you everybody
Bye-bye.
for attending this presentation.